Hi, good afternoon. My name is Tumbi.
Hi, my name is Thompson.
Okay, Thompson. So, in your own words, can you explain hepatitis?
Okay, I will simply say hepatitis is inflammation of the liver. It can be caused by viruses, majorly, it's caused by viruses, and it can be acute or chronic, depending on which stage it is.
Okay, so do you have any hepatitis story that you can share with us?
Yes, I know someone that has hepatitis. Yeah, for I think over 2 years. Yes, person has hepatitis over 2 years.
Can you please go deep into the story? Like, how did you find out what exactly happened? Did you get cure?
Okay, yes, the person presented with some symptoms, and then person started having some stomach pain. Yeah, not stomach pain, like some abdominal pain, and person had to go and see a doctor. So after diagnosis, person found out that the person had hepatitis, that's inflammation of the liver, because of some viruses they were present in the blood. So the person got diagnosed with it.
Okay, thank you. Can you list the type of hepatitis that we have?
We have five types of hepatitis. We have hepatitis A, B, C, D, and E. So B and E easily, no, not B and E. A and E easily go on their own. They can resolve on their own. But then B is severe, and it causes a lot of things. It's not curable, to say.
Okay, you mentioned already that what it affects the liver, right? I would have asked her what organ in the body. So, do you think hepatitis is common in Nigeria?
Yeah, it's very, very common. Based on the statistics I saw last, more than 300 million people are living with hepatitis, and then majority of them don't know because of the stigma and lack of information. They just think it's normal, and then the symptoms are just because of the differential diagnosis. They think it's presented as something else apart from hepatitis.
Okay. Can you? How do you think someone can get hepatitis?
There are various ways you can get hepatitis. First of all, the major way is blood contacts. So, but that's majorly for B and E. So other ones you can get from infected food, contaminated food and drinks, but then majorly for the B that is more severe, you get it from blood, and then that's through practicing unsafe sex, contamination from razor and needles, and then contaminated food and water, and many other things. Yeah.
Can you help us mention the ways to prevent hepatitis?
Okay, to ways to prevent hepatitis, of course, practice safe sex, and majorly hygiene. Hygiene is one of the best ways to prevent hepatitis. Practice a good hygiene, and then eat good foods for to prevent many. Okay, hepatitis can be prevented in many ways. So first of all is blood transfusion. Like practice a good and safe blood transfusion. Yeah, safe sex or that's to prevent majorly hepatitis B and D. So for other hepatitis, you practice good hand hygiene, eat good food, take good diet, then avoid contaminated food and water, avoid infections, eat good. Like, that's majorly just eat good, and then try to avoid contamination with viruses by practicing safe sex.
Do you know if hepatitis can be spread by sharing food, kissing?
No, but since I said before that hepatitis, there are a lot of them. There is A, B, C, D, and E. So from A, you can get infection from contaminated food and water, but from B, it's just spread from the blood. So getting it from the blood now, of course, you won't get it from kissing or sharing food. But those ones that involve contamination, that often resolve on their own. You can get these ones from food and water.
Okay. Have you heard of hepatitis vaccine?
Yes, yes, vaccination. I forgot to mention that part earlier from the not the prevention, just the way to cure it. You can cure hepatitis A and E majorly from maybe vaccination, and then yeah, taking drugs too. Or most of the time they often resolve on their own. Hepatitis C, you can take antiviral drugs to stop it. But B and D, there is no cure for them once you have them. So, but from recent findings and then the vaccines that we have right now, you can prevent hepatitis.
Have you or anyone you know taking the vaccine for hepatitis?
Yes, they take it to my school, the University of Ilorin. They take hepatitis and vaccine.
So, if someone have hepatitis, what symptoms do you think they will show first?
It depends on the type of hepatitis. Yeah, some of them prevent with stomach pain, diarrhea, vomiting, constipation in some cases, and then drowsiness. Some can even faint sometimes.
Where would you go for help if you suspect that you have hepatitis?
Okay, if I suspect that I have hepatitis, of course I'll go to the hospital. That's the first major reason. That's the first major place to go. You can't just go to someone that is not experienced, that is not a medical practitioner to diagnose hepatitis. You have to go for a blood test for them to see the viruses in the blood.
Okay, do you think people in this Lagos check their liver health regularly?
I don't know. I don't live in Lagos, so I can't say whether they check their liver health regularly. But then I will advise people to just go, even if it's once in a month or once in 2 months. They should check their blood. They should check their liver health, their organ health generally. A general checkup that would be good.
Okay. What about Nigerians? Do you think Nigeria as a whole take hepatitis seriously?
From the statistics I have, Nigerians do not take hepatitis seriously because it's not a global concern. They take other infections like HIV, other AIDS, syphilis, gonorrhea. They take it more serious than hepatitis, and I feel like hepatitis is a global concern because our liver is a major organ. It's a very major organ, and once it's breakdown, it's just gone.
What do you think the government or hospitals can do to prevent hepatitis in Lagos?
The first thing is awareness. Yes, making awareness, making people know about the risk, the causes, and the prevention of the disease. I think that's the major thing. And then over time, for people that have had this, they should make the vaccination that is ongoing right now to make it subsidized for people to have it. For people that have it already, for people that have hepatitis already, they should take those vaccines. And for people that don't know about it, so that they won't get it, they should practice safe sex, proper hygiene, eating good food, and having a nice diet.